Hi, this is Dr. Sabhapathi from South Bangalore, NR Colony, Basavanagudi. Today, I would like to say something about the latest update in hypertension. So, as per the WHO, nearly 60% of total deaths in India are due to non-communicable diseases, of which 27% are attributed to CVD, which affects 45% people in the 40 to 69 age group. Raised blood pressure is among the most important risk factors for CVDs. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow-up. So in India, the prevalence has also gone up over 30 years to 38% in men and 32% in women, from 29% and 28% respectively. Despite that, nearly half of the people, or 51% of the men and 41% of women with hypertension, were unaware of the condition. Additionally, over 62% of men and more than 53% of women living with hypertension did not get the treatment properly. Medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women with hypertension worldwide. International Society of Hypertension has released the ISH 2020 Global Hypertension Practice Guidelines. The inclusion of optimal and essential treatment paradigms attempts to address the issue that in resource-poor settings, optimal care refers to evidence-based standard of care, and whereas essential standards refer to minimum standards of care to allow specification of essential standards of care for low resource settings. The AHA ACC has released a scientific statement in 2021 offering a new guidelines for management of stage 1 hypertension among patients with low ASCVD risk among low risk adults, that is in CVD, and 10-year CVD risk less than 10% with stage 1 hypertension. Blood pressure 130 to 139 bar 80 to 89 millimeters of mercury. Management starts with non-pharmacologic therapy if blood pressure remains uncontrolled at 3 to 6 months. Consider starting pharmacological therapy. That is to say, blood pressure of 130, 139 bar 80 to 89. I think the lifestyle modifications itself will do for the patients to bring the blood pressure under control. That is, I mean that. Acute respiratory distress syndrome is a potentially fatal condition involving lung damage, and experts often associated with severe COVID-19. A recent study which appears in Journal of American College of Cardiology reports that metoprolol can reduce lung inflammation and improve respiratory function in people with severe COVID-19 induced ARDS, acute respiratory distress syndrome. So this is a new research that has been produced, metoprolol being helpful in ARDS. Lowering systolic blood pressure targets down to the 110 to less than 130 millimeters mercury range substantially reduced CV adverse events in STEP randomized trial, affirming the sprint findings for an older Chinese population among some 8,500 patients ages 60 to 80 in China. The intensive target trimmed 26% of the composite CV risk findings from now a second major trial supporting a lower target could unite the guidelines, which even among US professional societies range from thresholds of 130 to 150 millimeters of mercury. So with regard to prognostic value of ambulatory blood pressure monitoring and this nighttime blood pressure recordings, the 2018 European guidelines on the management of arterial hypertension recommend that the diagnosis of hypertension should not only be dependent on the office measurements, but also on the out-of-office measurement, such as ABPM, ambulatory blood pressure monitoring, or home blood pressure monitoring. 24 hours and night times BP measurements were associated with greater risk of mortality and a composite CV outcome. Thus, they may be considered as the most relevant measurements for estimating CV risk. For every 20 bar 10 millimeters of mercury increment of hypertension measured at night, the risk of mortality increased by 23% and the risk of cardiovascular events by 36%. So ABPM and this HBPM are the very accurate measurements of this ambulatory blood pressure in an individual who has a lot of fluctuations. Most patients with hypertension require lifelong medical therapy to achieve optimal BP control. The 2018 European guidelines equally recommend 5 classes of antihypertensive drugs, considering high non-adherence treatment. The importance of combination treatment is particularly highlighted to improve adherence to therapy and BP control. Therefore, the 2018 European guidelines recommend, especially in the context of lower BP target, to start antihypertensive therapy with an initial dual fixed dose combination of ACE1 or ARB plus CCB or the diverting. So this is what I wanted to convey today. I'm very happy to be associated with this company, and I'm very much thankful to the company regarding providing me an opportunity to talk on this occasion. Thank you, friends.